Kenya's tourism sector is currently in bad shape, and the country's tourism board has laid out a strategic plan to tap into potential revenue streams.
We clearly identify medical tourism or wellness tourism as one of the products that we need to participate in, to support. And the reason is because when you look at the spend per tourist, research indicates that the spend is usually between $20,000 to about $40,000 US dollars. And this obviously clearly then contributes to our overall receipts and therefore contributing to the national economy.
Supported by advanced technology and skilled medical labor, patients in the East Africa region are now opting to come to Kenya, which is closer home, for the same medical treatment they seek abroad.
Kenya right now is positioned to provide primary health care, secondary health care, and tertiary health care. Most of the patients who are coming to Kenya are coming for tertiary health care, and that's really super specialized kind of treatment that Kenya is now offering to the region.
And as a country, we are also very much aware that we have quite a rich repository of doctors who are able to do a lot of procedures. And this is the reason why, again, we are looking at two things. One is to reach out to both the local and the regional markets and get as many people as possible coming into this country to undertake some of these procedures here, to undertake some of these processes here, so that we can stem the flow of people going out of this country to other destinations in the world to do procedures and processes that could easily be done here.
And what are some of the options that patients coming into the country to seek treatment have?
We began with Nairobi Hospital, Aga Khan Hospital, and Mata Hospital, and Karen Hospital. Those are premier hospitals. But now we also realize that in the region we have got patients who are coming and they cannot afford to go to those premier hospitals. So we have got hospitals like Kenyatta National Hospital, where actually it's a benchmark. They control the pricing. Kenyatta has got one of the best doctors. The private wing of Kenyatta is very good. If you go there, you might think you're in a hotel. So our patients would like to go to Kenyatta as well. So we also have hospitals like St. Luke's in Eldoret, very good in orthopedic, Medihill, very good in fertility treatment. We have got Nairobi West, which have come on board, Mpisha Hospital, which have come on board as well. And this is just a second-tier hospitals. And majority of the East Africans, you find they're also sensitive about the cost. So we are giving them that option.
There are stringent measures that have been put in place for quality control.
The first thing they will send to us is the CV of the doctor who will treat the patient, because we have to ascertain that the doctor treating the patient is qualified enough to handle this particular case. Two, he must also demonstrate that the facility that is going to admit the patient, the facility has got the capacity to treat that particular condition. The second thing that we have is a quotation, which will indicate to us like how much money would be to pay for this particular condition, how much will it be to pay the hotel, and how many days this person is going to stay in that particular area or town or country for treatment. Then the other thing again is they will give us is the treatment plan.
Apart from serving East Africa, there are plans to reach out to other markets in the African continent.
We are already assisting patients traveling to Kenya from 5 different countries. And the Pride of Africa is our preferred carrier. We hope to improve our relationship with Kenyan Airways and rapidly expand our presence across Africa, making Kenya the preferred destination for the African medical traveler. And I would highlight that we are currently bringing patients from Burundi, Djibouti, Ethiopia, Rwanda, and South Sudan, and we expect to be expanding into 4 other countries by the end of this year.